We usually think of a broken heart as an emotional experience. What if I told you there's a hidden fire inside your body that could quite literally break your heart? Some of us are looking at incomplete markers for heart health. And so today I'm going to show you one hidden factor that could be putting you at risk. In a previous episode, I talked about how inflammation is a normal physiological response to tissue damage or chemical irritation, and how it can actually help with healing. I said it's like the healing fire, and that's true. But long-term inflammation is a different deal, and this can actually lead to damage to body tissues, and it affects many systems. We could think of it as the campfire that escaped the fire ring and is now burning uncontrolled. Today, we're going to talk about how chronic inflammation affects your heart. According to the CDC and the American Heart Association, heart disease is the leading cause of death in the United States, claiming over 915,000 lives, accounting for roughly 168 billion annually in healthcare costs. It kills more Americans than all forms of cancer and accidental deaths combined. I find that kind of shocking when I looked up that statistic. Almost half of all heart attacks occur in individuals without recognizable risk factors such as smoking, high blood pressure, high cholesterol, and diabetes. So these are markers that we regularly measure. Research shows that chronic inflammation is a risk factor for heart disease, and in many cases, we can do a lot to help keep our heart healthy by limiting long-term inflammation in the body. We can actually measure the levels. There's a lab test for something called C-reactive protein, which is a marker of inflammation. A test result of lower than 1 milligram per liter means that you're at low risk for a cardiac event. 1 to 3 milligrams per liter indicates average risk, and 3 milligrams per liter and up indicates an increased risk for cardiovascular disease, heart attack, and stroke. So let's look specifically at how inflammation, chronic inflammation, now we're not talking about the inflammation that we had with an injury, that was from a previous episode, chronic inflammation and how it can affect your heart. Inflammation can damage artery walls. We could think of this as the plaque trap. Inflammation makes those walls sticky, allowing cholesterol to get trapped and form plaque. Irritants like oxidized cholesterol, high blood sugar, and metabolic toxins can create inflammation in the blood vessel, damaging the cells that line those vessels, and that allows plaque to form in the vessels, and it can lead to clotting. Inflammation is not a leak that you can see. It's the internal buildup that eventually stops the flow. And we have here an image of the heart, and these are the actual blood vessels that supply the heart. And you can also see the conduction system, which is the electrical controlling system of the body. The inflammation doesn't just block the plumbing of the heart, it interferes with the wiring that keeps it beating. Chronic inflammation is like static on your radio, interfering with the signals that keep your heart beating in a steady rhythm. So now let's talk about what can we do about it. And I just want to preface this with, if you have specific concerns, you should talk about that with your doctor. The information we're going to be sharing today is general suggestions and information. So if you have a health concern, you should check with your doctor if some of these ideas are appropriate for you. The first one I want to talk about, this is kind of like your fire extinguisher nutritional recommendations. So we'd like to keep the fatty acids in the body in balance. It should be a 1-to-1 ratio between omega-6 fats and omega-3 fats. This generally means that you're going to have to supplement omega-3 fatty acids because our diet typically contains a lot of omega-6s already. So balancing your fatty acid profile, colorful leafy greens and berries, they have antioxidants that can help to neutralize the sparks of inflammation. Fruits and vegetables also have fiber that's really important to keep those vessels functioning optimally as well. Strategic movement exercises, we could think of that like cleaning the pipes. So moderate, consistent exercise, like a brisk 20-minute walk, helps to keep the blood flowing properly. At least 150 minutes weekly of moderate activity is recommended for heart health. And when we talk about exercise, we'd like it to be in the zone 2 cardio area. So what does that mean? It means that you're working and you're exercising, but you can still hold a conversation. So this is really the sweet spot for heart health without overstressing the body. It's about 60 to 70% of your maximal heart rate for your age. Most gym equipment, they have those little metal handles that you can grab and it will measure your heart rate. So you can check in periodically and see how you're doing. There's also wearables like your smartwatch and so forth that you can use. Stress management, very important. So cortisol is a hormone of stress and it's associated with chronic inflammation. So this chronic stress keeps the inflammation burning by constantly pumping out cortisol. Cortisol is anti-inflammatory in the short term. So what's supposed to happen is you have the stress, you release the cortisol, that helps to decrease the inflammation. But over time, if it's prolonged elevated levels, the immune cells become desensitized, and this immune insensitivity prevents the hormone from doing its proper anti-inflammatory activity, leading to persistent low-grade systemic inflammation. The role of the nervous system is also very important. There's a measurement called heart rate variability, and that means how your heart is changing its activity based on whatever's going on. Higher numbers indicate a heart that is healthy and responding well to changing stresses. So numbers like 60 to 100, depending on age, of course, can indicate healthier heart, while those below 20 can indicate a prolonged stressful state. The vagus nerve is the nerve that actually helps to improve heart rate variability and also can tone down inflammatory activity in the body. Keeping a healthy nervous system helps to keep inflammation in check. And those Oura rings or smartwatches can also measure this heart rate variability. According to an article in Frontiers in Physiology, meditation and breath work can also help improve heart rate variability. There's a mechanism called 4-7-8 breathing. So we're going to try that out now. This is a really good way to improve your heart rate variability and let your heart know that it's safe to relax. So let's go ahead and try that. The 4 is inhalation for a count of 4, then we hold the breath for 7, and then slowly exhale for a count of 8. So let's just do one cycle trying that out now. So Hold the breath. Gradually exhale for a count of 8. So that's just one time. You would have to do several cycles to really appreciate the relaxation impact of that. I've actually created a meditation and breathwork class that talks about this, and there's a couple of different breathwork exercises as well as a guided meditation. So I put the link to that in the description. Finally, you want to create for yourself a digital sunset to help relax you. So this means turning off screens and any kind of blue light emitting devices. So different kinds of light bulbs also can emit blue light 30 minutes before bed. So you lower your inflammation triggering stress hormones. I actually ordered blue light free light bulbs for the light fixture next to my bed. I love to read before I go to sleep, actual books, because of course, if I'm reading on my tablet, that's going to be blue light. So we don't want that. I got those light bulbs, and it's kind of an orange color. And I've really noticed a difference since I've been doing that at night. So no blue lights. An hour is actually better, but at least 30 minutes. So these dim lights are going to help to increase melatonin and lower cortisol to allow you to relax and get a better sleep. So you have the power to put out this uncontrolled fire that is chronic inflammation. We highlighted some nutritional and exercise methods to address this. Which of these areas do you find hardest to manage? Diet, exercise, or stress? Go ahead and drop in the comments about which is your most challenging area. You can also check out our previous video about inflammation as it relates to injury. Be sure to like and subscribe, and I'll see you on the next episode.